Hello, I'm Dr. Carl Rafey with Rafey Chiropractic here in Cincinnati, Ohio. I've done a lot of videos of me adjusting people, and those have been a big hit. We've got lots of comments. People like to see the cracking and the moving. And so I'm going to put together some videos. You're going to see some more adjustments in a little bit. But today we're going to talk about 4 frequently asked questions, and we're going to do a 4-part video series on it. Number 1, what is wrong with me? How do we find out what's going on with that? Number 2, what can be done about it? Number 3, how long is it going to take for me to get better? And number 4, how much is it going to cost me? Well, the first question we're going to get to today is what's wrong with me and how do we figure that out? When a patient comes to a chiropractor, what we do is we analyze the spine. We basically look for a joint that's kinked out of place, putting pressure on nerve, and that causes symptoms. And symptoms are an emergency indicator within the body. And so when you come into my office or when you go into any chiropractor's office, what we're going to do is we're going to take a history, and that's going to give us an idea of where your problems came from. And then we're going to do an exam where we check your range of motion. You're going to move your head and neck in all different directions and see which way it's going. And then we're going to look at your back and wherever your symptoms are at. Then what we're going to do most of the time is take an x-ray. And what I do is I take a digital x-ray so it pops up on the screen, and then we can take a look at exactly what's going on in your spine. Now, when we take a look at that, we put it all together in a report for you. And that way we can show you why you're having your symptoms, where the misalignments are at, and how we can change that. Now, the next step will be we're talking about how are we going to fix it. What does that take? Does it hurt? How long is that going to take to get fixed? So I'm going to adjust a couple people, and then I'll be back with you to tell you more about that on the next video.